Ocean 89.
It's 6:15 on a Monday, and right now it is time for Vision Talk, our monthly talk put on by Vision Bermuda, formerly the Bermuda Society for the Blind. And it is my pleasure to welcome on the phone with me good friend. Many chats we've had, and I'm pleased to welcome Sara Bosch Noya from the Bermuda Diabetes Association joining us today. Sara, welcome.
Yes, good evening. Good to hear you.
Yeah, we haven't talked in a good little while, you and I, but I'm glad you're over here on this side talking about this stuff, which we do every month. And, of course, being as it is Diabetes Awareness Month, and you're out there in front for this very, very amazing association and support group that helps just about everyone who has any issues to do with the disease of diabetes. And what we're here to talk about specifically today is managing diabetes with sight loss. So I'm just going to let you start where you want to start. Maybe with, we have had Dr. VC on last month to talk about diabetic retinopathy. But if you just want to do a quick overview of that, maybe as the thing that causes, vision loss really quickly. Yeah. And then we'll talk about what's going on for the month and anything else you want to tell us.
Well, that's great. That's right. And I'm not, nor do I profess to be an ophthalmologist. Huge respect for all of us health professionals.
Sure.
Stay in our lane. But the associated link, obviously, and thanks to Vision Bermuda for the coordination that we do and that we have done. We've done a couple of segments together, and obviously the collaboration between our entities makes sense, and certainly we are here to support many people. Sadly, vision loss, vision deficiency, really, and sight impairment is a risk to those living with diabetes.
Sure.
And so, Shelley, really, I'd like to perhaps, in very simple terms, explain why that is, and what diabetes is, and how that therefore can and does cause vision damage. Diabetes, as we know, is prevalent on the island. I was doing some statistics today. Our national prevalence rate of diabetes, we estimated around 13% of the population, and that's probably slightly conservative.
I was going to say underestimating a little bit, I would say.
Exactly. And I think if we included people who are living with pre-diabetes, that condition where your sugars are slightly more elevated than they should be, particularly your fasting blood sugars, but not yet diabetes, you're in the risk lane. It's probably higher, could be as high as 18 to 20%. The global, if we look at the International Diabetes Federation, global prevalence of diabetes is about 10%.
Okay.
So if we're talking already at a conservative estimate, 13%, we're higher than that. And we know that the link, Shelley, with genetics, with culture, with lifestyle, and all of that. We're a small little island. I'm Bermudian and proud to be myself, but we're a small we're a small genetic pool here, gene pool. Thank God for all the others who come in here and help spread our genes around a little bit. But the incidence of diabetes is a condition, quite simply, where there's too much sugar in the blood. And people, we've got we're really strong out there with social media this month. So I would ask that anybody who likes to follow Facebook or Instagram, look at our postings this month, Diabetes Association, because we've got some really interesting facts on diabetes and what we're acknowledging really this month in November. Diabetes is simply having too much sugar in the blood, and in type 1 diabetes and in type 2 diabetes, the cause for that is very different. In type 1 diabetes, pancreas doesn't produce any insulin anymore, and people have to take insulin for the rest of their life. In type 2 diabetes, the pancreas is producing insulin, but people become insulin resistant. And in other words, they're not using the insulin properly anymore, and that is again, there's a host of physiological reasons for that. This condition of having too much sugar in our blood causes problems. It causes problems, Shelley, in the very tiny microvessels and the larger, bigger vessels that run through our body. So the big vessels, those macro vessels that supply blood to our heart and in and around our cardiovascular system, is what we associate the prevalence of the increased risk of strokes and heart attacks with diabetes. And then these tiny little vessels, the microvessels that supply blood to our eyes and our kidneys, that increases the risk of damage to those tiny little microvessels that supply the eyes, the back of the eye, the kidneys, and all with oxygen and with normal glucose levels. So when we have diabetes for any length of time and our blood glucose levels for years over time are running at higher rates and the blood sugars are higher than normal, we're going to potentially be damaging the lining of those vessels and compromising the delivery of oxygen to healthy tissue and therefore starting to lay down the complications. Does that make sense? We're damaging those sources where the blood flow should be good because we've got more sugar in the blood than we should have.
And that causes inflammatory situations.
Yep, and exactly, and that causes damage and an oxidative process. Really, that in the eye, the retina is the back. This is tissue in the light sensitive tissue in the back, layer of tissue in the back of your eye, which can become damaged over time, as we said, with an increased supply of that blood, which is containing levels of glucose which are too high. So, very simply, people say, well, how do I prevent diabetic retinopathy, or how do we prevent that diabetes retinopathy? It's not a simple, well, I've got to do this to my eye or this to go and see you. Eye examinations are critical, and once a year examinations by anyone with diabetes to get a proper, a comprehensive dilated eye exam to make sure that there is no, this as anything, Shelley, is critical to detect as early as we can. But really, newly diagnosed with diabetes at any stage, type 1 or type 2, the mainstay for preventing diabetes eye complications is to try everything in your power to manage your diabetes and control those glucose numbers at a normal level. If we're staying in a lane where our glucose levels and sugar levels are as close to normal as possible, this is why we health professionals work so hard, and your GPs and your doctors and your nurses and everybody, we're here to support and educate people to make them understand that that the better you can try and achieve those glucose numbers that are as close to normal glucose numbers as possible, the less risk you are of developing any of these complications, particularly when we're talking about the
loss of sight,
loss of vision. Absolutely.
Yeah. Can I ask a question real quick? Is it more prevalent to have the diabetic retinopathy in type 1 or type 2 diabetes? Because type 1, like you said, the pancreas does not produce the glucose, so it's controlled by various systems of delivering it and checking to see that there's not too much or too little. But in type 2 diabetes, is it more prevalent because that's more of an inflammatory and lifestyle choices and things and so on that are harder to police for some than others. So
So in either case, there's kind of a little story behind each. I mean, in type 1 diabetes, sadly, I know, there are many people and certainly Bishop in Bermuda that we can talk about, people we know we worked with type 1 diabetes. Type 1 diabetes, people are often diagnosed with type 1 diabetes in their early childhood. You could be 2 years old, 5 years old, so by the time you're in your 20s or young adult age, you've been living with type 1 diabetes over 10, 20 years, 15, 20 years in some cases. So the longevity and the sort of the chronic nature of that time can often lead to the fact that this is probably one of the more common causes of blindness or vision loss in younger people in terms of type 1 diabetes who have had diabetes already for a long time.
Yeah, it's mileage and wear and tear.
Yeah, the mileage and particularly control in situations, pregnancy, for example, with somebody who has type 1 diabetes accelerates, and that growth and kind of the development just in terms of what's happening to a woman, to a body in pregnancy, we know that this is and this sadly have seen where this can accelerate the development of complications in type 1 diabetes. So it really is critical. This is where pre-pregnancy counseling through your GPs or OBGYNs for women with type 1 diabetes, considering a pregnancy, we want your glucose levels to be
really
normal
important.
as possible, so that we're protecting any advanced damage which may happen to the acceleration of diabetes complications. So type 1, we're walking on a critical line there with the duration of time that people are living with type 1 diabetes. It doesn't go away. It cannot be reversed. But what I'll say conversely to that with type 2 diabetes when we know that so much of type 2 diabetes can do, and much less so now perhaps because our health community and GPs are very much on the ball and looking for it and screening for it regularly. But if type 2 diabetes, someone can be living with type 2 diabetes up to about 2 to 5 years before it's diagnosed. So
Gotcha.
the prevalence of sort of undetected or undiagnosed type 2 diabetes means that often at diagnosis with someone diagnosed with type 2 diabetes, if that person goes to an eye exam in that first 6 months of a diagnosis, they've already in a high percentage of cases already got the first signs of diabetes retinopathy because they
got some damage already.
They've been unaware.
Didn't know
exactly that the diabetes is actually has occurred. So. That's another driving force to becoming diagnosed with diabetes as soon, so that we aren't walking around with a high risk of undetected complications, which are going on behind the scenes as we're unaware of the condition.
Yeah, we all know that prevention is much better than than trying to figure out after it's
Absolutely.
advanced or something. So it's really important to know. But managing diabetes when you have experienced sight loss now, I mean, you guys have great support systems for those with sight loss that are trying to manage their diabetes, conversely.
Yeah.
Right?
Yeah. I mean, exactly. I mean, it is a challenge, and it's one that we're far more wanting to stand on the side of preventing somebody from losing their sight. And this is where, the services and the rehabilitation and the support that Vision Bermuda can provide to patients once they've had that, experiencing that compromise in any of the functions. And we, have blood sugar meters and other things which can help with a person with sight. But we're passionate about preventing people from becoming affected by vision loss. And I think straight across the board, it's probably, when I, Shelley, have had the privilege and pleasure of working in diabetes care now nearly 30 years and not wanting to date, but this is probably something where people sit in front of me and people are genuinely fearful about.
The most afraid of losing their sight,
I've just been told I have diabetes and I do not want to go blind, or I do not want to, lose a leg. But probably the first thing out of their mouth is something they say they do not want to lose their vision, they do not want to go blind. And that we know that if you've seen our logo for the Diabetes Association looks like a hand with 5 fingers, and it represents the 5 complications of diabetes: blindness, kidney damage, amputation, stroke, and heart attacks. And blindness is, and this is what vision rehab will do, doesn't necessarily need to significantly impact a person's ability to function and self-care, but it certainly is it impacts many of the functions that we do day to day.
Absolutely.
And somebody particularly in a person's working career and all of that. So I think that it's imperative that people understand that it really boils down to, in simplicity, what can I do to maintain my diabetes and manage that? Reach out for education, reach out for support. We have phenomenal advances in diabetes technology, medications, and what we know about the potential with type 2 diabetes to reverse type 2 diabetes, where we've talked about that, you and I, on some of our shows, where 10 years ago I wouldn't have said on an interview that we could reverse type 2 diabetes. And here we are, with 95% of any diabetes population in any country being type 2 diabetes affected. This is something which we largely can empower and help people. If we can help people to come off some of their medications, get their glucose levels down to near to normal limits, and even getting them in normal limits and reversing their diabetes, absolutely is therefore preventing them from developing complications.
So nutrition and exercise is at the forefront of controlling diabetes, preventing it. Yeah, preventing
type 2 diabetes. They say that up to 70% of type 2 diabetes can be prevented or delayed through lifestyle, choices and modifications. And here we, we're at BBC and Ocean. We're constantly broadcasting this new Freestyle Libre glucose sensor, which probably over 1,000 people in Bermuda are now wearing this little device on your arm. Which
I would say not a day goes by that you don't see someone with that little white dot on the back of their arm. And we're, thank goodness that
And I think wear it proudly, Bermuda, because
Sure.
we have this in many countries in the world, and certainly outside of our North American region, in our countries in the Caribbean down to the south of us, don't have access to this little product. And what I've seen it help people do in understanding how their glucose and sugar levels rise and fall during
Sure.
the day, depending on what they eat. So if I tell someone, if you eat a banana, it's going to do that to your glucose, but you have a bowl of blueberries, it'll do that and make that difference. And then you modify what you eat.
Sure.
Multiply that over 3 or 6 months and going back to your doctors with what your levels of your blood sugar numbers look like. And if you're somebody who's teetering on the brink of retinopathy or early vision loss, your doctor's going to say, listen, your glucose levels are high. You've been to your eye doctor. The eye exams are not good. You need to do everything in your power to get your glucose levels down. See a nutritionist, see, your GP, your diabetes team. But if we can put this little device on your arm and you can show yourself or teach yourself, and in terms of, yes, we do training here, and I
Sure.
help people to understand the effect of it. But it's been a really a very, very enhancing experience for a lot of people to be able to better understand their glucose patterns.
Mm-hmm. And it's really important that that people realize that, having that knowledge, having that power really does put
Absolutely.
the ball in your court.
Yep.
Because
Yep.
you control what's going in your mouth, right?
Yep.
We
Yep.
all have that individual control. No one's being force-fed around here,
Yep.
right? Well, not generally speaking. So,
Absolutely, Shelley. Knowledge is power. That's all about what drives me to do what we do every day here. And I think empowering people certainly, and also to take the fear out of it. People
Sure.
with diabetes live in a lot of fear, and they sense that the diabetes controls them, not they control it. And I want to, empower people that with a device like this, and you can better understand and interpret the things that you're doing, and people can come to a registered dietitian and you can develop a diabetes plan. And worse than that, you see people going on Google or on the internet and downloading some diet or plan, and it might not be relevant to you, but,
Sure.
or you might not think this isn't something I can do it. But when you start to make your own modifications and write down a food journal, write down a food log, look at the results that you're getting if you're checking your blood sugars, and then you
Sure.
can understand these patterns. It's been phenomenally helpful to our diabetes community.
And I think the real important thing is the feel-good factor, right? Because by having this type of control, and I've had someone, a colleague of mine who recently got the Libre, and they say that you feel like you got this now. Like it's no longer
motivational.
stressful.
Yeah.
It's no longer stressful.
It's no longer stressful. It's motivational too, and you're scanning this device on your arm to produce, so you're not finger pricking. And let's be honest here, we're very grateful that finger pricking has been around probably
Sure.
since the 1960s and 70s as a means other than urine testing, which was around before that for measuring glucose.
Sure.
So, but I mean, I have helped, and I've helped 2 vision impaired patients put on a Libra, and this is something where they can hear the machine beep, but they may not be able to read the number accurately, but they can have a family member. Still, it takes away that need for maybe 5 or 6 finger pricks a day or more
Exactly.
than that to understand what your glucose. And I think when you look back at it and talk to people about, what we need, patients in order to manage their diabetes better needs to know what their glucose numbers are at. And then
Sure.
you can go to your doctor and say, yes, we had this discussion about my eyesight or my complications, and I need to get my diabetes numbers down. Well, how do you know they've come down? Because you've got to check them. Before that, we had to prick our finger with a drop
Sure.
of blood, and it kind of feels a bit punishing.
Yeah,
'Cause it
I'm sure
hurts.
it's a little invasive.
Yeah, and I look at patients of mine who've been with me for 20 years, and you've got calluses on their fingers. So to be able to provide a device like that, the incentive where you say you have to do everything you can to give me some numbers to show that your diabetes is, particularly where somebody has gone to their eye appointment and they've noticed the early onset or visual changes which may require surgery or may require some intervention. They're usually very, very, very motivated and willing to look at making changes to get those glucose numbers down. Well, instead of doing 8 finger pricks a day, let's hook you up with a continuous glucose monitor or something that can
Sure.
give us that information. 2021, 2020 has been a difficult years, but we do have technology that's come through on the diabetes side of it in the last 5 years,
Sure.
Which is game-changing in Bermuda. We're lucky to have this device here.
Can we just clarify something real quick? You talked about, intervention and surgical intervention in diabetic retinopathy. What is the prognosis if one has said, oh, you've got X amount of damage, say it's a 20% loss of vision or something, can it can that type of thing be reversed, or is it just about arresting it at that point so you don't lose any more of your vision? How does that work?
It's both. I mean, it all depends on the level of
Gotcha.
The level that, again, early prevention. This is why we stress to all of our diabetes patients, do make sure that you get an annual, this dilated eye exam where you're making sure that you're getting that checked each and every single year, because you don't know, and the earliest that it's detected, the later that it is detected, obviously the prognosis is poorer, and in many cases it just does become a state of arresting the damage at where it is,
Gotcha.
Rather than reversing it. But it is absolutely, the treatment of diabetes retinopathy depends largely upon the timeline of when it's been detected, and there have been success stories with many of our patients, and that's what we always hope and pray for. But the name of the game is definitely in early detection, but prior to even that, prevention. And it all comes down to anybody that's listening, and if you have a loved one with diabetes, is helping them and supporting them and educating them to get these blood glucose numbers down. And let me just say this too, Shelley, because I think it's something we don't talk about. There is a stigma, I think, associated with diabetes that not many people share and have adequate support. You may have a loved one who's kind of bugging you to get your numbers down, and you don't necessarily look at it as a support. You know what I mean? But
Gotcha.
We're all in this together. If you've got a loved one with diabetes, and making sure that that you're fully on board, and that it's not an easy with diabetes, particularly type 1 diabetes. It has no days off. There are no days off with type 1 diabetes, and it's something that you remain steadfast to, and you have good days and you have bad days, and you try and but the outcome and the reward, or really the reason why you're keeping your foot on the pedal when it comes to managing these numbers is to try and prevent development of these devastating complications, which we wish that years on, that there could be a cure for type 1 diabetes. And this is what, that worldwide type 1 and type 2 diabetes will look very different in that. I'd like to think that even in my lifetime we'll be around for a cure for type 1 diabetes.
Yeah.
Type 2 diabetes, it's far more lifestyle related, and that's going to be difficult for us to see a world cure for that.
Oftentimes, there is obesity involved, or at least carrying around too much weight as part of type 2 diabetes development. But and in type 1, I've known many who are quite fit athletes and stuff there, so there's no reason to not try and keep your body fit at all. And oftentimes there's lots of help just to get you on that road where exercise is going to bring you a little bit of joy instead of just pain. So getting that fitness regimen in line is a big part of what you guys talk about, right?
Critical, physical activity is critical to. I mean, what do you and I use glucose for in our body? We use glucose for energy. So with or without diabetes, when we eat foods that contain carbohydrates, it turns into glucose, and that glucose is with the correct with the release of insulin from the pancreas, that insulin transport glucose into my cells for energy.
Sure.
So for type 1 diabetes and type 2 diabetes, using a regular physical activity as an exercise, as an adjunct to helping to manage glucose levels. People with type 1 diabetes have a very challenging time managing physical activity with lower, making sure that with taking insulin as an every day, that they don't go low or their numbers are high. So it's a balancing act with type 1 and type 2, and physical activity is obviously a critical key to that. Population-wise, I think we hear this year in Bermuda, globally, worldwide, Shelley, we are looking for our diabetes awareness campaign this month at really acknowledging 100 years on from the discovery of insulin. It was 100 years ago in 1921 that the Canadian scientists Frederick Panting, Charles Best, and his Scottish colleague, Dr. McLeod, were championed with the discovery of insulin as a means to keep people with type 1 diabetes alive. And then in that following year, the first patients received insulin injections. So 100 years on, that we're still battling with globally across the world, Shelley, people having equal access
Sure.
to insulin, affordable access to insulin, which prevents diabetes complications, but first off the bat saves lives.
I was just going to say, it's not possible to
Life-saving
live
for
with
type 1 diabetes.
type 1 diabetes and not do your insulin.
Yeah, it's what we quite simply were doing some really profound testimonials with some of our patients with type 1 diabetes, and one of the questions, what does the discovery of insulin mean to you? And really it's life. It's looking in the eyes of your children or your spouse or your partner or your pet. The gift of it, the discovery of insulin is the gift of life.
For sure.
Equal access to insulin and affordable access, not scrimping on your insulin or, not taking it or rationing insulin, meaning that your sugars are higher and this is the development of complications or worse, still contributing to deaths from diabetes that shouldn't occur.
Sure.
That it's still happening in 2021 is something that we all need to stand up and take action against.
Well, for sure. It's hard for people to think about, you can't live without this stuff. But if there's a financial issue, do things like, with 100 years on, making it affordable has gotten better, or in your experience?
I think we're trying to, this is the International Diabetes, global campaign for this month is, if not now, when? And it's really calling to action governments and national groups to make sure that that insulin and access to diabetes medications is accessible and affordable to all. And particularly in the case of with type 1 diabetes, people shouldn't still be choosing between the cost of insulin, medication, or food.
Sure.
On that note, before we end, and I know, Terry, that's the problem. You and I get off the bat and start talking, but I want people to know that the Bermuda Diabetes Association, one of our most important programs here at the Bermuda Diabetes Association, 1 year on in our new home since last year, and we had this program in effect before that, similar to programs at Bermuda Cancer Health, is that we have a patient's assistance program.
Okay.
We have a strong patient's assistance program, which obviously has seen the funding and the needs for that in our community almost triple since the pandemic. But we are here. We do not want anybody in Bermuda to
go without
not
their
have
insulin.
access to insulin or medication. And we have a core list of medications here that we cover. Come in and meet with us, come in and call us, reach out and discuss this with us for diabetes supplies, for insulin, for medications.
Sure.
This is what we are very, very grateful to a lot of our corporate donors for this, because we would struggle to support this on our own.
Absolutely.
And we have our pharmacy here. And so this comes back to why I'm sitting here, representing and speaking for Vision Bermuda. If your blood glucose levels are too high because you can't afford your medication, and if it's type 2 diabetes, if it's your pills or your tablets, or if it's type 1 diabetes and it's your insulin and your glucose levels are running high, and this maintains, this goes on for a certain, your eyesight, your
eye health is at jeopardy.
Eye health is at jeopardy. Your kidney health is at jeopardy. So all of this is why we're here.
That's why we're talking about it.
And why we want to make sure. That's why we're talking about it. And if it comes down to the fact that my sugars are high because I can't afford my medication, please do know that the Diabetes Association has our CAPS, our Patients Assistance Program, is here to help you. And we are very, very grateful to any donations and our donors for allowing us. We've had to look at it several times during the year, hopefully not scale back and try and continue, because it, as I said, has trebled in what its annual demand was in the last few years leading up to COVID.
Okay, so we got just a couple minutes left. Let's talk specifically about what else might be happening. Diabetes Awareness Month. Of course, diabetes can lead to vision loss, which is why we're talking about it on the program today. And we want to encourage people to reach out to Vision Bermuda if you've had this diagnosis. You need to talk with Sara and you need to talk with Tisha at Vision Bermuda. That's just how what you should do. Boom, boom. Doesn't matter which order, but you should talk to both of them.
We've had many great chats together, and looking for the collaboration between Vision Bermuda and Diabetes Association makes sense to support our people. Obviously, for any services that can assist you if you have any vision impairment, and the prevention comes from both of us, from them and from Vision Bermuda and from us. We on Monday the 15th of November, which is a week today. Shelley, so On Sunday, this Sunday coming on the 14th of November, all around the world, every year, the 14th of November is always celebrated as World Diabetes Day. It is the birthday of Frederick Banting, one of the biochemists celebrated with the discovery of insulin. But on the next day, as it's a Monday, the 15th of November, not really in any big event for numbers and COVID safety and security. We're having a sort of a gentle open day here at our facility all day long from 10 until 3. There'll be some sampling, and I'll be doing blood sugar screening and blood pressure screening, and come in and just drop in and see us. Many of our people with diabetes have come in to see our facility since we've opened last August. But come in. Come by, if you don't get your pharmacy, your medications from our pharmacy, come in and see us. We're a one-stop pharmacy, not just for those with diabetes, but anybody can come in here and get your prescriptions here. And if you have diabetes, you can get all your medications here, your eye drops, your cholesterol pills, and your diabetes medications, and all of it's here. And we have a great team. We really, I think, pride ourselves, Shelley, on having a relationship with our clientele and patients that come in here. They know us, we know them, and that's very important to us. And in trusting somebody with your health and looking to staying well, and vision loss and all of that, is we want our patients with diabetes to live well, and that is absolutely one of our mission's objectives. And
you guys do have the wonderful new facility over there on Dundonald, correct?
I'm still here, sitting
in the office. And of course, Vision Bermuda just had their roof wedding. They're getting to the end of their renovations just down the road from you guys.
Absolutely. So we moved out of that, lovely, it was a symbiotic, great relationship we had. We moved up the street, down 2 blocks.
Yep.
And around the corner, up the road and around the corner, up the hill and around the corner. So do come by Monday the 15th, a week today. As I said, a kind of a gentle open day. We don't anticipate, but, Larry, we're all being very, and a lot of obviously what we have been able to do this year has been somewhat impacted by COVID, and we're very sensitive to that and encouraging people to stay well. With diabetes. So come and see us if you haven't. If you need, if you get insulin, do come here this month. It may be that we might be having some treats and some goodie bags. Watch for that space towards the latter part of the month. We have something special for those of you who are on insulin in celebration and recognition of 100 years of insulin to acknowledge that.
Well, Sara, I know you've been at the helm of this for a long time, and I hope it continues, because the trust relationship that you've developed with your clients goes leaps and bounds into making it easier for people to cope with the things that they have to cope with diabetes. So we hope you keep doing what you're doing for a whole lot longer, and we hope you come talk to us again whenever you need to
Thanks,
keep
Shelley.
The awareness where we need it.
Had the path, really paved for us fantastically with the Diabetes Association, and it's certainly not something I take for granted, and a pleasure to do that. But this is what we're here for education and support. And come on down to us and see if any way, in any capacity, we can help. With education, with that, as I said, a financial assistance program. But we want to keep everybody well, and we will continue to work with our community partners, our health professionals, and Vision Bermuda to do what we can. And this really is another situation where you say it often. It takes a village, really, to help all of us on the island and all of those with diabetes live well.
Thank you so much for joining us, hon.
Thanks, Shelley.
Take care. It's been a pleasure. Bye-bye, Sara.
Bye.
Okay, folks, you've heard all about it right here on our monthly Vision Talk. Our next one, I believe, will be Monday, December the 13th, and we will be talking about how to include a person who is visually impaired or blind during social gatherings and activities. And our guest speakers will be Tisha McMorty and Patty Jean Roberts, both of Vision Bermuda. We've talked to both of them before, but it will be nice with the holidays coming up to help people try to deal with the social implications of vision loss. So we're looking forward to that, and we hope you will join us.